Hi, everyone. Welcome to another episode of Management Through Crisis, where we explore the personal and social impacts of the coronavirus outbreak on individuals and the community. Today, we'll be speaking with Associate Professor Dr. Marc Archer from HELP University, who will be speaking about how we can learn from the global experience of COVID-19. Dr. Mark's a lecturer in the Department of Psychology and also currently heads our Center for Mental Health and Wellbeing. My name is Elaine. I am the head of Department of Psychology at HELP University, and we will be talking to you about what we can learn about the common experiences and how we can use these to improve our mental health. So, hi Mark, how are you doing?
Hey Elaine, good, not too bad. Nice to see you, and thanks for the invitation.
Okay, so just to jump right into it, maybe we can start with what are some of the common impacts on mental health that COVID-19 has had around the world?
Okay, so I think we've talked a lot, and there's been a lot of talk in the media about sort of very common effects: anxiety, depression, stress. So that sort of diffuse stress is common around the world. So if we look at it in terms of rather than common symptoms, just the commonalities. So a few things in addition to that, what we describe as diffuse stress. So that comes around from the uncertainty of not knowing if you're going to be affected directly. Maybe you might be infected by the virus, effects on your job, your income, your family, etc. In addition to that, a couple of specific things that are probably worth noting around social isolation. And there's been a fair few reports recently about how that's being dealt with, the effects that we'd expect from social isolation. So we know that contact with other human beings is essential for us to basically to function at all. Physiologically, we just kind of break down if we're not around other people, although moderating it is good too. So during social isolation, maintaining that has helped a lot, but certainly there have been spikes in loneliness and loneliness-related depression, and we can gauge that by people reaching out for support services. Another aspect of social isolation that's a little bit more complicated is that being around those that are closest to us, in addition to being able to support us, also poses a risk for some people, a minority, we're a sizable minority, and instances of domestic abuse have gone up to, so obviously this has direct mental health implications in terms of trauma, in terms of just suffering this kind of abuse. And in the US and the UK, for example, those things have increased substantially, like 25% increases, including cases of domestic abuse, violence, and murder. So very, very serious things. And there's no reason to really believe that this isn't happening in other parts of the world. It's just that the UK and the US are probably quite open about it. Another area that's a little sort of less extreme is the impact of sleep. So sleep, again, is essential to our psychological functioning. And if people are experiencing mental health problems, any kind of low intensity strains, often that'll be manifested in sleep problems. But similarly, if you're not getting a good enough sleep, you're at higher risk of developing thinking and sort of mood instability. So social isolation, this shift in lifestyles led to these general, very pervasive trends. So in the UK, for example, a survey recently showed that like 2/3 of people reported having diminished sleep because they're worrying about COVID-19. So pretty substantial. At the far extreme end of mental health, suicide rates have increased, and this has been across different demographics. So among the elderly, for example, among people who are in healthcare, very tragically in healthcare positions, experiencing something called compassion fatigue. So when you're vocational and you basically dedicate yourself to taking care of people, that can become very, very difficult when they're not getting better. And when a crisis like this perpetuated over a long period of time leads to exhaustion and burnout. And in some cases, if people are particularly struggling with an underlying mental health problem, it increases the risk of suicide, and that's happened.
Okay, all right. So it seems that in terms of mental health, there are a lot of risk factors that are currently being potentially exacerbated by
Exactly.
the situation.
That's the exact way to capture it. Yeah, I mean, we always have these problems. It's never really smooth sailing, but now it's intensified in different places in the world at different degrees.
Yeah, okay. You mentioned sort of the US and the UK, but given the rise in sort of the mental health issues that people might be experiencing. What are other countries sort of doing to address this? Is there anything we can learn from them on how to manage things here as well? Obviously, keeping into consideration some of the cultural differences
Sure.
and things like that, of transferring some of these methods back to the Malaysian context.
Yeah, absolutely. So, I mean, a little bit closer to home then, if we look at China, China's set a really good example in several ways. And it's always controversial to look at modeling oneself on China, but a few things that they've done that I think are admirable. So if you just look at, and of course data is potentially questionable, but if you just look at the way they were able to contain the virus physically, geographically, you know, is staggering really. But similarly, they were very prepared for psychological first aid intervention. And to an extent, that was because they'd experienced similar epidemics in recent years, like SARS. So through these experiences, they've really prepared themselves, and they recognize a vulnerability in a large population. So very early on, they were able to mobilize systematic and differentiated psychological services for people across different levels of society. And I think, so it's hard to say, well, how could we implement that now? And this is a professional service. But in terms of some of the ethos that's behind that, so for example, it was on a level of need. So those who had the virus, patients, would have obviously greater priority and greater intense treatment. Family members would then get the next level of treatment, and then maybe healthcare workers and those who were supporting and volunteering. And implicit to that intervention was this understanding, and people were reminded that this is really going to be able to help you, and this is evidence-based, and this has helped people in the past, which really helps. But also letting them know that there had to be this priority. So yes, we want to help you as much as we can, but this is what you're going to be able to get now in terms of resources, because we have to pull together for the greater good. So I think that's something that we've seen everywhere, and certainly in Malaysia too. But so on a formal as well as an informal level is just this idea that we have to work collectively. But yeah, China's sort of collectivization of its mental health intervention has been very impressive. I have another example, but from the UK again.
Sure,
so this is my bias. So I should say in advance, my biases are probably going to be the UK for having being from there. But also my biases are toward healthcare workers. And maybe this next example can kind of demonstrate that, why I think this is important as a bias and can help all of us in the long run with our mental health, and helps us as a society. So are you familiar with the Stay Home, Protect the NHS, Save Lives campaign? Yeah, in the UK. So the people who came up with that campaign, it's reminiscent of the, Keep Calm and Carry On campaign during the war. So that's not accidental, surely. And the people who developed that, the branding people who developed that slogan, the current one, they've also developed lots of other sort of somewhat witty ways of telling people to stay at home. So, things like on the subway, if you're outside and it says, wish we weren't seeing you here, but, kind of friendly, familiar, but with a very serious point. And that's been exported all over the world, which is impressive. So this sort of public health, professionally branded sloganism is really good. But the reason why I think the Protect the NHS, Stay Home, Protect the NHS, Save Lives one is so important and so good, it gives everybody something very, very solid and unambiguous to rally around.
Right.
And we've said before, we just need a lack of uncertainty as much as we can for our mental health. It also gives us the chance to look beyond ourselves, which again is essential, and look to those that are really on the front lines, and express our gratitude. And just expressing gratitude, again, is a good practice for enhancing well-being and sort of increasing your resilience. But also, it's helping these people who are working on the front lines, because the NHS in the UK, for example, is the biggest employer in Europe. It's, I think, the 5th biggest employer in the world. So this is not a niche, small subpopulation. This is not only the core population that's going to keep us alive, but it's pretty big, and most of us are going to be pretty related to them. So it has immediate and sort of more sort of diffuse effects on our well-being. And letting them know that we understand how important they are, which we often don't, and that we care about them, is going to bolster their capacity to stay mentally well, physically well, and deliver what they need to. So I feel like it might not seem on the surface like a mental health intervention, and it's not, but the implications for mental health, I think, are really impressive.
Okay. I think there's a sort of similar movements here with like hashtag Kita Jaga Kita and all of that here.
Brilliant. It's
Yeah, I
lost
think
on me. You see, I need to study BM more. Yeah.
it's like we look after us, I think is the hashtag.
Right.
Um, and
Right.
but what you're saying about making things a little bit more specific so people understand the outcome of their actions,
Mm.
which can be quite abstract. I think what does stay at home mean? Why exactly is it that I'm staying home? But then once you
Right.
tie it to an actual uh, outcome that is
Yes. Yeah.
that helps them understand the purpose of their actions better and gives meaning, right? I think we talk about a lot about Frankel and all of that now. So it doesn't seem
Right.
like at
Right.
home has a lot of meaning, but
Yes.
it gives people a purpose for why they're having to stay where they are, and it might help some. Maybe not everyone. Obviously, people have different levels of need, but
Yeah.
it could give some others a sense of meaning. That's a
Yeah.
really good
Absolutely.
point. So speaking on that end, what resources are actually available to people who are a little bit more vulnerable? So some of these messaging might help those of us who are on the sort of milder to less severe end of the scale for a lot of these mental health issues, but there are people who are a lot more vulnerable to
Mm-hmm.
some stresses, as you mentioned, people with underlying mental health issues, people who are already directly experiencing trauma
Mm-hmm.
from the
Yeah.
situation, whether it's because of the COVID-19 itself or because of the circumstances that have changed.
Yeah.
So what resources are currently available for people who are in that category?
So, I mean, a wide range, but paradoxically, perhaps too wide a range and can be quite dizzying for people. And this is just a general problem for mental health services, people not knowing what to turn to. So, I think a way to boil it down is that if you look at different levels of intensity, if you're just not sure whether or not you're at that stage where you should be seeking help, then MMHA, Malaysian Mental Health Association, they're offering a free emotional support call to anyone that wants it. And that's basically you just call someone up who has an idea about whether or not the worries that we're experiencing maybe could warrant something else, or they can reassure you and just let you know that that's normal. So that's a really good point of entry. And they can signpost you then onto something that will give you more comprehensive, more specialized professional services. The first point of entry for professional services, so I just asked the head of psychiatry for Selangor about this today. The first point of entry is a Ministry of Health website is the go-to point. So the address that I've been given, and I think it's a good starting point, is, let me just check that, it's doctoroncall.com.my. So this is a virtual portal. And from there, you'll be able to identify directions to psychiatry or psychology, so a range of mental health experts. Um, but a lot of people might not want to engage with something so personally. So there are things in between those two. And one of the advantages of living in a globalized world, I mean, the disadvantage is that we can spread a virus very quickly. An advantage is that we also have access to services anywhere. It's not localized. So, for example, you can access professional therapy through something like telemental health. So, one of the I'm just looking for the name of one of the services that's offering free health at the moment. So, Talkspace. So yeah, so Talkspace has been donated because they do very well, thousands of hours, or I think even months of therapy. So you can go to Talkspace and you can get treatment from someone, a live person, anywhere in the world. So yeah, there are lots of it's amazing the philanthropy and to say sort of the humanity and people donating at the moment. So I think this is a good channel. It's interesting. I think this is a realization, another positive effect. As consumers of mental health services, we can access a lot more, but also as providers of mental health services, we realize that our reach isn't localized either. So I was talking to somebody who works with people with addictions and families of those with addictions in the northeast of England yesterday. And as they've gone online, they've realized that they know they have a good service. They know that their service is better than in a lot of places, but they've always offered it within their neighborhood. But now they're able to offer it very, very widely. So I think that's, if you go online and, you discern to an extent, and you can find some very, very good services everywhere.
Okay, so there's local as well as international services that people can access, and also a lot of free services, I think.
Yes.
Yeah, so there's either free mental health help, or even those that are charging are doing so at a much reduced rate, I believe, in the city, able to help to accommodate for different ability financial abilities and understanding that people might be severely impacted at this time.
Right, right. And self-help, I mean, I just about self-help, I mean, there's a good evidence base for self-help now, not necessarily just going and randomly picking a book off the shelf, but there are mental health apps or web-based interventions that have worked with clinical populations and, led to significant reductions in symptoms. So another example, the Department of Veteran Affairs in the US, so they have a really sophisticated mental health team, including with Stanford, they have a mental health apps development team, and all of their apps are available for free. And a lot of these have been through rigorous randomized controlled trials. So again, if people aren't wanting to engage this immediately with a real person, and people, using our smartphones is ever handy, they can go to look for these kinds of available apps.
I think that might also be important for people who may not have easy access. So if, for example, you are experiencing a difficult home situation, and it might not be so easy to go on a webcam call with someone or be on the phone with someone.
Precisely.
Using something might be able to mitigate some of the impact of that situation on individuals. So that's a very important one to bring up, I think, for people who maybe lack access in that way.
Yeah.
Okay, so just to sort of close out, because I'm conscious of the time. So when the current restrictions end, we know that there might be a lot of changes to the way of life as we sort of know it. How can we best prepare ourselves for what will come? I know that's asking you a bit too much.
But, but I mean,
some things to think about once the restrictions.
My reflections are kind of. It's going to be we're going to be liberated in a new way, because we've found that we've had to find new ways under constraint to free ourselves through things like online, like this, which is wonderful. I think we'll have to approach anything when you've been contained for a while, step slowly back into the light. We don't want to shock ourselves. I think on a collective level, I've said this, I've talked to a lot of friends about this, and I think it's a common sentiment. The compassion that we've all felt and we've seen around the world, I think gives us hope. Having been through and actually still, I mean, we don't want to sound naive, but, things are pretty bad politically globally, but maybe there's a chance for a movement from something like this, from, the masses who have come together. So I think, what we've realized about what we thought were constraints in our lives, and now that we've had these constraints imposed, we realize that actually there are ways we can do things that are probably a lot better. The way we work, the way we go to school, we've found as a university, for example, there are lots of things that we can do in new, efficient ways that have benefits. So I think similarly for people's lifestyles, when they're looking at how they work and how they relate to the people around them, can be really beneficial. I think one other element, though, the other side of that technology is we've also realized that we don't want to become overly dependent on technology. And when you're faced with a prolonged threat, as we've all been faced more or less intimately, you perhaps start to look at the smaller things in life. And I think that's the other thing. So looking at the simpler things, and hopefully we can appreciate those more. Yeah,
certainly. I think especially when it comes to relationships and, just being physically present with someone, I think a lot of people are going to be looking forward to that.
Yes, I'll never take shaking someone's hand for granted again.
A while before we can do that, but hopefully sooner rather than later.
Yes, it will happen. Yeah.
All right, so thank you so much for your time, Marc, and for the insights that you've shared. This has been another episode of Management Through Crisis. Please keep an eye out for more episodes from us at HELP University in collaboration with Leaderonomics across our different social media platforms. Thank you, stay safe, and please take care.